All right, welcome back to Let's Talk Live. Studies show that holiday weight gain can add up and take several months to lose. The good news is, if you fuel up with the right foods, you can prevent those extra pounds from piling on, while slashing the risks of obesity, diabetes, heart disease, and even certain forms of cancer. Got a full panel here today to talk about everything. Dr. Neal Barnard, founder of Barnard Medical Center, registered dietitian Karen Smith, and Betty Mizek, a medical social worker and a patient at Barnard Medical Center who is actively fighting heart disease with a colorful plant-based diet. Welcome. We are going to start with you. I know you said you didn't want to start, but we are going to start with you because let's talk about your diet. And before we went on the air, we were talking about beets and all of the great food. So talk about how this has transformed your life.
Well, I'm a heart attack survivor. In April, I had a heart attack, and it was a wake-up call for me. I had known about plant-based food for many years. I'm a medical social worker, but as you know, us in the medical profession, we tend to, look at our patients and not ourselves.
Right.
So anyway, I dramatically changed my diet. I started eating plant-based, went to the Barnard Center, and I've dropped my cholesterol 150 points, my triglycerides 62, and my hemoglobin A1C has come down 2 points. So I'm on the right track, and it's really helping me to reverse my heart diseases, which actually I'm trying to do.
And Doctor, talk about, is that possible to reverse these things with plant-based food?
It is, and when I was in medical school, I was taught that this isn't possible, that a heart attack is sort of a one-way street. Diabetes is a one-way street. The biggest breakthrough we've had is that we now see these as two-way streets. We've seen people where they've had diabetes, they don't have it anymore as far as the numbers show. They had heart disease, but the arteries start to open up instead of getting more narrow. However, you're never going to do that by just switching from beef to fried chicken or something like that. We're talking big changes. So that's why the vegetables and the fruits and the beans and the healthy foods come front and center in our diet. And then the trick is, let's make them in a way that everybody's going to want to eat them. So if you don't have heart disease, we're going to prevent it. If you've got it, let's do what we can to reverse it.
But you're saying it's possible. It just takes work.
Not only is it possible, it has been proven.
It's been proven.
With scanning technology, you can look at a person's arteries that are narrowed like this. You put them on a plant-based diet, V-word, vegetarian type of diet, get the meat out, get the dairy out, and you scan that same person a year later. And as long as they're following a generally healthy lifestyle along with this diet, those arteries start opening up again. And their chance of having another heart attack just went right through the floor.
Right. Karen, we're going to get to you in just a moment here because I want to talk about all the food, but I do have a question to you, Betty, about how hard was it for you to switch to this diet?
Well, it wasn't hard for me because I was very motivated by the heart attack. But the advice I received was just do it a day at a time. Don't think you're going to have to eat like this the rest of your life.
Right.
Just do it. And what happened is, as I started doing it, I started feeling great. Like I feel the best I've felt in 40 years. I've had diabetes for 40 years. So, and more energy, just feeling great. So, and that motivated me more. And then the numbers, my cardiac risk was like a 5.1, which was off the charts. It's down to 2 now. So I'm out of that cardiac risk range already, and only in 2 months on the diet. I've been on it 8 months now, but 2 months after being on it, all my numbers went down.
All right, let's talk here now about some of the food that people should be eating.
Yeah, great. I love talking about food. So we have some really amazing dishes here packed with fiber and low in fat and absolutely no cholesterol. So really nutrient dense too, and loaded with a lot of antioxidants and phytochemicals that are just great to help fight infection and prevent and reverse heart disease as well as type 2 diabetes and help you stay on track with maintaining a healthy weight. So we have this awesome squash dish that is so simple to make. It's just a combination of brown rice, black beans, onions, corn, and some broccoli. And you can prepare it beautifully like this and make a beautiful tablescape too. We have a really awesome big beet. So simple. All you have to do is wrap these beets in foil, put them in the oven for an hour, just let them go.
Yeah.
Really tasty.
And so good for you.
Yeah, so amazingly healthy. Betty, this is her superstar salad that she goes to, loaded with grapes, carrots, apples, and kale. And the dressing is just 2 ingredients and no fat: banana and apple cider vinegar.
Really?
Yeah.
You smash a banana up?
Right. Well, you put it in a food processor,
Oh.
and it looks like this. It's incredible. It's almost like mayonnaise, but it actually tastes better.
Right.
And it's just apple cider vinegar and banana.
And I think that's something important to point out before we get to the brownies, because we're not going to miss the brownies here. But that once you start, yes, not right away, but you start to acquire a taste for that good food. You start craving that good food. That's all your body wants then. Right. It's not hard to avoid the bad food, right? Once you start eating it.
Well, when you eat fat, you crave fat. Right. And so you stop craving the fat after you stop eating it.
All right, now how are these brownies going to be on the list of good?
Okay, well, I love to make these brownies and not tell anyone what the superstar ingredient is.
Should I eat it first? And
go ahead.
Take a bite.
Okay, and see. Okay, so I got a regular brownie.
Amazing. So
very moist.
Key ingredient is black beans. And beans are proven to help stabilize blood sugar, but also help with maintaining a healthy weight. So a really fabulous goal for people, if you're not eating some type of bean or a lentil every single day, focus on how you can include them into your diet on a daily basis. Really beneficial.
Amazing. Okay, we're out of time. For people that have been watching at home right now, I know they've heard Betty's story. I know they've heard you guys talk here, and they're ready to start changing their lives. What's the next step?
The next step is don't think long term, think short term. Think the next 7 days or something like that, especially during the holiday times. Instead of gaining weight, this is the time to lose weight and get healthy. Think short term. Every meal that you have that is a plant-based meal, it's money in the bank.
And you guys have free cooking classes, and how do people find out more about that?
Yeah, absolutely. You can go to barnardmedical.org to find lots of information about our free cooking classes and other nutrition classes, possibly schedule an appointment with one of our providers, or join our 21-day vegan kickstart.
Good. Betty, thank you for sharing your story.
Thank
Everybody,
you.
thank you for coming. Great to meet you.
you.
Wonderful. We'll have more of Let's Talk Live. The number is on the bottom of your screen. Start today, just a little bit. The first step's making the phone call. We'll be right back.